Welcome back, everyone. You know, when someone asks for a gummy bear, take a look at what's in here. It's usually what comes to mind, all these gummy bears. But more women who are considering breast reconstruction or augmentation are asking for the new FDA-approved implant, which is named the Gummy Bear. Board-certified plastic surgeon Dr. Jeff Angobaldo of Renaissance Plastic Surgery and Forest Park Medical Center of Frisco join us now to explain. Good to see you.
Thank you.
This is really new.
It is, and we're using a lot of these now for breast reconstructions. And last month, as you know, in October is Breast Reconstruction Awareness Month. And for us in our practice, it's Breast Reconstruction Month or Awareness Month every month because we're always educating patients. We're seeing breast reconstruction patients on a weekly and monthly basis. So It's an incredibly rewarding field.
Okay, so let's talk about the difference. We had a shot before. Let's take that shot again because when you're holding it up, you can see the difference. In this hand, I'm holding what?
You're holding the 4th generation implant, which is the most common implant being used today.
And it's rippling.
It's rippling.
Just naturally in my hand, but this one is the Gummy Bear one.
That just got FDA approved about 3 months ago, and it's a more cohesive gel implant, which allows it to hold its shape, hence the Gummy Bear name.
So women who have saline, let's say they have a rupture, which is rare, but it can happen. It kind of dissolves into the body, whereas, and I have a pair of scissors here, what happens if we have a rupture in the Gummy Bear? Can I just cut it here?
You sure can. If
well,
you
it's hard
can.
to cut.
It's a double outer shell.
Look at that.
And as you can see that the gel maintains its shape. If there's ever a rupture with these implants, it's very difficult to diagnose unless you get an MRI. But it actually holds its shape, maintains its shape, unlike the older generation implants.
Yeah, that's not going to go leaking into the body. Like you said, you'd have to discover it on an MRI. That's a huge benefit. You can tell, too, it's firmer.
It's a lot firmer. It's some of the benefits of this implant versus the 4th generation implant, which we're probably most commonly used today, is that this holds its shape.
Right.
When you stand it up, yeah, it holds its shape. There's more fullness inferiorly, so it's very anatomically shaped. There's a lot less rippling. And
That's true, because look how much rippling is on this one when I hold it side by side.
And there's less complications, such as like contractures, and a lot of and patients are actually very satisfied. They did a study, a 7-year study, showing a 95.6%
I believe it.
satisfaction.
Okay, so a ton of benefits to this type of implant. Who's a good candidate for something like this?
Well, patients that want a very anatomically shaped breast, because as you can see, the way the implant's shaped, people have a very natural looking breast as a result. Patients that want less upper pole fullness, because as you can see with the implants, most of the implants fullness is inferiorly, so it's very naturally shaped. So if someone wants very big implants, you're not really a great candidate for this surgery.
So can I ask what cup size would be a good candidate?
I would say up to
what?
Maybe a small D.
A small D would be perfect for this. Nothing really bigger than that, though.
Yeah, and obviously patients with chest deformities or bone deformities are not great candidates for this particular implant.
Okay, do you see this as kind of being the future implant?
I think we'll see this implant will be the future as the older ones are, also the 4th generations, but I think every patient's a little bit different. But yeah, this is definitely the future for certain segments of our breast reconstruction patients, for sure.
Okay, what about the surgeons themselves? What type of surgeon can place these implants?
Well, with any type of breast implant, a board-certified plastic surgeon should be the only surgeon that should be placing these implants.
Are those the 2 words we should be looking for, board certified?
That's correct.
Because what essentially does that mean?
It means that we're actually well trained. We go through a rigorous training program, and board certification means that we're safe surgeons and we're ethical surgeons. And we go through a lot of training to make sure that we're the best at doing this procedure.
And as far as the Gummy Bear implant is concerned, is it the same type of insertion and recovery time and all of that we're used to seeing?
Well, the implants, since it's anatomically shaped, it's a little bit more of a tedious surgery because you have to make the perfect pocket, because if it rotates a little bit to the right or left, you'll have a little bit of an abnormal looking result.
Well, it's very interesting, and we can definitely see the benefits. Doctor, thank you so much.
You're welcome.
You want a Gummy Bear?
Sure, thanks.
All right, for more information about the newly FDA-approved Gummy Bear implant, you can call the number on your screen. It's 972-378-3870, or just log on to RenaissancePlasticSurgeryTX.com. You can also find out more by just logging on to ForestParkFrisco.com or call 214-618-0500.